ladies and gentlemen. In the last 2 days, I think we could listen to wonderful presentations about researches, services, treatments to be used. But I don't know whether you are all aware of the fact that everything the speakers were talking about need to be at least recognized, but rather supported by governments. And in order to do so, we need lobbying. In the next presentation, I will show you a possible way of lobbying, which we call the National Autism Strategy of Hungary, which is probably not the very best way. I'm wondering if there is a best way at all. But I truly think that it's a quite good way to cope with this problem. When working at an NGO and you try lobby for better services for people with ASD, sometimes you can feel that you are kicking a ball which is the same size as you or even bigger than you, which is almost impossible to do so. So I think we need special approaches, and I think what we call National Autism Strategy in Hungary is a possible way you can make this huge ball move. What's coming up? At the very beginning, I have to briefly present the situation in Hungary regarding the status or the problem of people living with ASD. So there will be a few facts mentioned. Then I will tell what is a strategy, what we call our strategy, and finally we will go into details and see what is the structure, the content of the strategy and how it was developed. Let's see the problems. Generally, we can say, and I'm sure it's not very specific for Hungary, that services are not available for people with ASD, or if there are services for people with ASD, then the quality of these services is at least, let's say, questionable. I could also say at most of the services we can see awful quality of the service. Even if we are talking about health services, I don't know how it is in other countries, but for instance in Hungary it's almost impossible to find a dentist for somebody who lives with autism. If we are talking about autism-specific social services, we can acknowledge that there are very few of these, especially concerning daycare centers or community homes for adults. If there are more social services, then they are not autism-specific. Therefore, in the end, when somebody with ASD gets a service from a not autism-specific service provider, there can be very bad things happen in the end, and we have so many legal cases at our Hungarian Autistic Society dealing with this problem. In the education, I think education is among the major problems in our country. The population living with autism in Hungary is very specific, as the majority of the population living with ASD is in school age now. So most of the legal cases or the problems we hear about are in education. There are very few autism-specific schools or school units even. And there is a problem which we call hidden diagnosis. It's very interesting. 2 years ago, we looked at the numbers of the data collected both in the national health system and also in the national educational system. Both data come from schools. Well, the educational system obviously comes from school, and the data from the national health insurance system come from hospitals. And looking at the school-aged children living with ASD, there was a huge difference between the numbers. So when trying to see how many children there are living with ASD in school age, we could see that the national health insurance system recognizes two times more children living with ASD at the same age group. This includes all the children in Hungary, than the national educational register system do. This is impossible. Why does it happen? Because the diagnoses are hidden. why do parents hide the diagnosis or the professionals? Because if you have somebody, if you have your child living with autism, then most likely the school will refuse somehow to give educational service, let's say, to teach, to take in your child. Of course, legally they cannot do so, but they find a way to do so. So it's a huge problem in Hungary in education, and also the employment of people with ASD is on a very low level. Looking at the numbers, we can see a diagram, and the bars are standing for the actual number of children at school age living with ASD. You can see that the number of people affected with autism is rising rapidly. Actually, it's very frightening when looking at this number, because the improvement of services just cannot keep up with this rising. But of course, on the other hand, we also have strengths, such as even though we have very few professionals who are highly qualified in autism, those very few professionals work with evidence-based methods, and this is the good thing to start with. Then we have recent sociological researches, so there are certain data available, which is a very good start when trying to plan service systems. You have to use numbers for this. And then we have a quite huge bunch of written resources, books, either translated or either originally written in Hungarian, books which are available for professionals and parents. But on the other hand, we have profound weaknesses in our system, such as the lack of professionals. Can you imagine that a country with 10 million people and with the number of children you can see here? So in 2 years ago, there were at school age 1,600 children living with ASD all around in the country. So this means that many times in a school you can find only one child. That we have, I think it's true if I say that we have like 30 or 40 highly qualified professionals in autism. This is due to the lack of academic training. There is still no graduate training in autism in Hungary, while there are academic trainings for special teachers for all the rest of disability groups. Of course, we are lacking legislative provisions such as the obligatory use of special methods in schools when teaching children with ASD, and we have a quite weak non-profit sector where it's not a miracle or it's not very surprising to acknowledge this, because we only have 20 years of history in democracy, so we cannot have a very well-developed NGO sector. And of course, the services, the social and educational services, are underfinanced. So when looking at the picture, looking at the big picture, and say that we are lacking professionals, we don't have access to services, we cannot use schools, or if we want to use schools, we have to hide our children's diagnosis, then we could say that, and I don't know whether it's clear for you why I chose this picture, that it's a place where you just cannot live. It's impossible to live in such a society, and if you picture it as a room where you are expected to live in, then you could see that it's such an untidy, such a messy room. You just cannot live in such a place. I think, and I regret to say that, but it's true that families who are affected with autism, I think they often have the same feeling. Even though legally, the legal frames are sometimes perfect, they let you live with your rights, they let you use services, and they tell all the nice things, but as Evelyn told us, they are just poems sometimes, and they are not reality. And I do think that families affected by ASD often feel that the world surrounding them is not a livable place. So what is a strategy? A strategy which we also can call a scheduled plan or an action plan. A strategy is the way things or tasks should be done in order to make a room looking like this into a room which looks like this. It's very well structured, it's tidy, you can use this room, you can live in such a flat. It's a wonderful place for living. But of course, to do so, to make things change, to make a messy room and to rebuild it or to renovate it and make it a livable place, you have to schedule your tasks. And this is what the National Autism Strategy of Hungary tried to do. Well, yes, now we know that we have so many tasks. I'm sure that you have already known that before I started to speak. But who knows where to start with? I mean, who knows who is responsible for what? Of course, we always blame governments, but this is rubbish. I'm sorry to say that this is not true. We cannot blame always governments. Government people are supposed to make decisions and make the legal frame, but they are not supposed to do everything. Who is responsible to set up a new service system? Of course, it has to be financed and recognized legally by government, but who gives them the input? Should it be the professionals, or should it be the families or the NGOs representing the families? I think none of them and all of them. If they are not working together, then whatever comes out cannot be used in the same way. What's the first step? We know that we have different stakeholders. We have government people there, and we have professionals, we have families and NGOs with loud voice. But where should we start? I'm sure that many times when NGOs try to make things change and try to set up new service systems for people with ASD, they make a mistake at the very beginning, because they think that if there is no school or there is no enough school with proper methods for people with ASD, then let's set up schools. I truly think that it's true if I say that that's not the case. We shouldn't start with building. We don't need bricks. We need plan. And this is where our approach, so instead of lobbying for more money for services, we were lobbying for the autism strategy. This is the point where we chose a different way. And this is where we chose comprehensive planning instead of instant implementation. Of course, it was time-consuming, but time-consuming means that you just need a well-structured plan, and it's not something to be avoided off. Instead, it's something to be prepared for. And of course, if you have a plan like this and you are planning to make a strategy, and I hope many of you will decide after turning back home to start something like this if you haven't done so, then the first thing you have to do is to convince your government to recognize the need of such a strategy. Until they don't recognize the need of such a strategy, it can happen that there are certain lobby groups, there are different NGOs. There is my NGO, which is always the best. There is her NGO, which is not that good. I don't like them very much because they don't know what to do. And we have different ways to ministry people, and we try to lobby for better services, and we just don't cope with each other. And all these different lobbies just weaken one another instead of strengthen one another.